Good afternoon, everyone. Thank you for joining me on this month's edition of Healthier You here at Oswego Health. This is our first Healthier You event of 2022, and we're very glad that you joined us. We are celebrating heart health this month in February, and we have our panel of experts to help you. We're going to take a few minutes of your time to share some information, resources to keep you healthy. As always, I'm so glad you joined us. And in the future, if you have things that you want us to address and talk about, please let us know in the comments section. We're always looking for things that are interesting or topics that you would want us to address in Healthier You. So I'm going to start. I'm Katie Pagliaroli, the Vice President of Clinical Services and Integrated Healthcare here at Oswego Health. I have with me today Dr. Thomas Grady, our cardiologist, Olsen, who's one of our registered dietitians, and Tish, who is the Director of Health and Wellness for the Oswego YMCA. Thank you so much for taking the time to join me this afternoon. I'm going to start, Dr. Grady, with you a question. We often hear about family history and genetics playing a role in cardiovascular disease and heart health. And we wanted to ask you, what are some things we should be looking for as factors of what might put us at risk for heart disease?
Thank you, Kate. It's good to be here, and I want to thank everybody for participating in this program. So, yeah, your family history is very important, and it's really important to talk with your parents or your grandparents about their medical problems. If the heart disease runs in the family, whether it be underlying coronary disease or a cholesterol problem or rhythm problem, because they are genetically linked, and that's a huge risk factor. That's really nothing really can do to control that. But what we can control is our lifestyles and how we, exercise or fitness programs. Starting off when we're actually, we're very young, in even elementary school, and continuing that as we go on. And nutrition is also very important as to help preventing things that can happen later on. Because there's some things we can't prevent. That's your family history, and you're getting older. So a family history would be, the definition would be someone in your family that had heart disease if you're male younger than 55 and female younger than 65. So if you have a first degree relative that has that, then you might say, geez, do you have underlying coronary disease, or was it a rhythm problem? It could be a genetically linked, what we call channelopathy, or it could be a cholesterol problem too, where the cholesterol is very high. And actually blood pressure, the number one cause of blood pressure is your genes, and they can't change that. So we're addressing those risk factors early on in life through nutrition, fitness, weight management is really important to do. And then Trish is going to talk a little about just your quality of life, finding a passion or interest that you enjoy doing, a hobby, whether it be gardening or kayaking or music or art, knitting, crocheting, something that really, is really important to do so it takes the stress out of our lives. So those things, I'll watch out for in looking for heart disease, and just really just a fitness program where you're walking maybe 30 minutes to 45 minutes every day of the week. And this time of the year it's hard to do that. Maybe getting an elliptical or a stationary bicycle, or joining a club that has a swimming pool, go do a water aerobics. Those are all things that really be important to do. So that's what I would watch out for.
Great, thank you. Those are important tips, things that are going to help us to improve if we do have those genetic risk factors, and we'll talk a little bit more about that. Allie, I'm heading over to you. We talk about heart healthy diet. Some people turn their nose up. They're like, oh, that's boring. It doesn't taste good. I can't eat anything I enjoy. I know that you're going to give us some tips of how we can enjoy a heart healthy diet, something that we can stick with and not just have it be sort of a transient or fad. What do you have or information for us about that?
I think the bland misconception comes along with the fact people are trying to reduce their sodium or their salt intake. Too much sodium can lead to high blood pressure and heart disease. So instead of seasoning with salt while we're cooking, can we use lemon juice, lime juice, herbs, spices? There's a lot of great salt-free seasoning blends out there, like Mrs. Dash or the other store brand versions. Another big thing we can do is add heart healthy fats to the diet. Those are called unsaturated fats. For example, olive oil, canola oil. You could roast your veggies with your favorite oil and your favorite salt-free seasoning blend, or adding some heart healthy fats in the form of healthy fish like salmon, tuna, and avocados for some heart healthy fats.
Great. Those are some really great tips to make that heart healthy diet interesting and tasteful. And that goes along with some of the things Dr. Grady was just talking about. Now, Trish, I'm going to go to you. The YMCA is a great community resource that we're lucky to have within our community, and many communities do have a YMCA. And we wanted to talk with you about what does the Y offer for classes that might help us with exercise, especially if we've already had a cardiovascular disease or if we're looking to prevent cardiovascular disease.
Absolutely, Katie. The Y is a terrific place for families, youth, and individuals, and especially those recovering from a cardiac event, because staying physically active is an important part of keeping your heart healthy. We offer so many programs and services, including a full fitness center. So Dr. Grady alluded to walking. This time of year, it's not always conducive to be outside, so we do offer a variety of treadmills, recumbent bicycles, rowers, cross trainers, power mills. We've got a variety of equipment that would fit that bill. But once your doctor lets you know that it's the right time to begin an exercise program, we welcome those individuals here in the Y. We work with them to find the program that best fits their needs, their schedule, and most importantly, what's fun, what they're going to enjoy. Returning to exercise after a cardiac event, or even starting a new exercise program altogether, can be really challenging and even anxiety provoking for some people. So starting with small amounts and steadily building up can help you be more successful in that endeavor. We do offer several classes that are kind of more geared to coming back from a cardiac event. They would be our Silver Sneakers Classic class and our Silver Sneakers Yoga class. And they are offer chair for support, but the yoga class is traditional mind body, working on yoga poses. The Silver Sneakers Classic integrates some light weights, some resistant bands, some balls, so people are actively working on resistance training, which is very important to overall health. Additionally, individuals might find that through their insurance providers that their membership at a YMCA is covered under Silver Sneakers programs. So they need to check with their insurance providers, and they can come right into the Y and it won't cost them a thing. But regardless of ability, and I think everyone notices an improved overall health and wellness by participating in some sort of regular exercise program. And we're here at the Y, and we have a lot to offer. So we welcome individuals to come in. They can try the Y for free at any time. So stop by and see us.
That sounds great. Trish, we do have a question about that. If I wanted to become a member, and I think that's a great tip to check with your insurance carrier. Sometimes
Absolutely.
cost can be a perceived barrier to joining an exercise program, but how would I become a member if I wanted to join the Y?
You would stop in and see us. We have some application, paperwork to fill out. We have a variety of levels of membership, anywhere from a full family membership, one parent family membership, adult couples, young adults, teens, youth, senior couples, senior individual. And we also offer what's called a membership for all, which is a income-based, kind of a scholarship-based membership, because at the Y, we don't like to turn away anyone. We don't turn away anyone regardless of income.
Great. That's so helpful, right? Help us to get out of the mindset that it's out of reach for us. I have another question here. This one's for Ellie. Could someone make an appointment with you or a dietitian to talk about good nutrition and some easy ways to get into that heart healthy lifestyle?
Absolutely. Feel free to call the Oswego Hospital main number. Ask to speak with the dietitian. We can set you up with an appointment. Another good option is to talk to your primary care provider or your cardiologist and get a referral.
That sounds great. And we will post the main number in the comments for you if you're looking for that, to be able to call and reach out. I think a great point, and Dr. Grady, you talked about this as well. If you haven't been to see your primary care provider or a specialist, it's time to make an appointment. Get your cholesterol checked, make sure you're doing that preventative care, because it's really important to keep you healthy in the long run, to identify what your risk factors are. Talk with your family. And if you aren't sure about what those genetics are, get into that conversation with your family and pick a time to kind of bridge that gap. So I think those are some really great tips that we can use as we talk about heart health. I think that's all the questions we have for today. I really want to thank you. This has been a lot of great information for our community and things that we can all do to improve our health into the future. Thanks for joining me here on Healthier You.
Thank you.